Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners disrupt the norm by throwing away the rainbow art and being the best you can be when working with older adults.
You know when you have those patients that don't want to put up handrails on the stairs or outside the house because they're afraid it'll make the house look ugly or make the patient look, quote, old? Well, I found these handrails from Promenaid that are super stylish, come in all sorts of finishes and colors to match any type of house. I like that they're super adjustable and you can literally put them anywhere, even those funky corners where the patient needs something but nothing ever quite fits. They ship quick and be installed right away, so we can adapt the home to what our patient needs fast, which is our number one priority. Check them out at promenaid.com, Promenaid.com. Welcome, everyone, to the Seniors Flourish podcast. My name is Mandy Chamberlain, and I'm an occupational therapist, and I love to talk about anything occupational therapy, and especially working with older adults. So if you are new to the show, welcome. Today, we are talking about working in skilled nursing facilities, some of the pros and cons, sharing some stories. And I actually really love this topic because I've worked personally in skilled nursing facilities off and on my entire career. Some of you may have heard my story of how I got into OT. My grandfather, Gramps, went into a skilled nursing facility. I'm going to try really hard not to use too many acronyms if you're not familiar with working or skilled nursing facilities. But I want to welcome my guests, Holly Masters and Allie Izzo. They're both occupational therapy assistants, and they are going to tackle this topic with me today. So I'm so glad you guys are here today.
Yes, thank you. We are so excited to be a part of this. This is super cool.
Yeah, we've been following you forever, so we're just so happy to be here.
Awesome. Oh, I'm so glad you're here too. So this will be really, really fun. So if you're a regular listener, most people know that I like to always start with people's kind of OT journeys, how the heck they found OT and what are they doing now. So I don't really even care which one of you guys starts. So who wants to start?
Okay.
Talk about your journey. Let's hear it.
Okay, so my journey, this is Holly. Pretty much I was in high school and I had no clue what I wanted to do. I was a senior and my uncle, he had a stroke. So he, went to the hospital, then went into an extensive rehab system by my house. And he called me and he was like, you need to come down here and, see what they're doing. Well, my aunt told me. And so I was like, okay, so I went and I got to go to therapy sessions with him. And pretty much I would actually get out of school half a day and I would go volunteer at the therapy clinic. And I was able to sit in during his therapy sessions and just ask questions and learn about occupational therapy, physical therapy, speech therapy, and everything that they were doing and the reasons that they were doing the things that they did. So I was able to watch him progress. And it was so cool. I absolutely loved it. And then I ended up looking for OT schools in my area and found Penn State. So we toured it, and that was that. So we did that and then went through school. I did a clinical rotation at an outpatient specialty hand clinic, which I loved. And then I also did a rotation in kind of traveling between nursing facilities. And I really at first thought I wasn't going to like working with older adults and in nursing homes, but I absolutely love it. It was the best experience. I'm so glad that I got placed there because I love it. So that's pretty much
Isn't that stuff your story? That's the stuff about I think I've talked about this in some other episodes, but I think sometimes people you're in school and there's all these kind of sexy populations to work with. You're like, ooh, I'm going to work just in neuro, or I'm going to, I'm a pediatric OT. And, in general, I'd say not a lot of people are like, I'm going to be a geriatric OT. And you just kind of you just kind of fall into it. And sometimes I think people are limited by, are afraid to kind of do a level, 1 or 2 in these areas because they're like, I don't want to do that. But you never know until you do those experiences what you fall in love with.
Very lucky.
I don't know. Yeah, that's so cool. How about you,
Yeah,
Allie?
so my story is a little bit different. I was a junior in high school, and in one of my classes, an old neighbor of mine actually was coming in. She went to Pittsburgh, to the university there, and I hadn't heard from her in years. I wasn't really sure what she was up to, and she was coming in to talk about her time at Pitt and what she was doing, and she was going to be an OTR. And I had no idea what occupational therapy was at the time. And so she came in and she gave a presentation and just kind of talked about what OT was, what she was doing there, and her clinical experiences. And so then I was like, wow, that sounds really interesting. I think that's something I would like to do, because I was still kind of pondering the idea of going into forensics. So kind of took a whole different turn.
Wow.
But then, same as Holly, I went to Penn State. That's where we met. But my dad worked at Penn State. So when I went home and I was talking about how, I really wanted to look into occupational therapy, he had mentioned that he knew they had it there at the school. So I was able to go down and sit in on classes. And my senior year, I was able to volunteer at an outpatient place in town and also at a nursing home. So that's kind of how I got started.
Do you guys work at the same nursing home now?
I am PRN at the facility that she works at, but we've never actually worked together.
Oh, okay. Okay.
Yes.
Just went to school together. Okay. So for like people who are kind of trying to figure out like what is a skilled nursing facility, how do you define what that is?
So I guess just like a broad terminology. I mean, just the skilled nursing facility meeting the criteria of, Medicaid and all the reimbursements and all that kind of stuff. I guess that's kind of like a difference.
Yeah, I would say in some, like, it can also be short-term care. Like we have some patients that they're discharged from the hospital, they come to like the skilled nursing facility, and then they're going to be discharged back home. So that's a little bit different between like the skilled and then just a nursing home.
Right. Yeah, and I mean, because there's all these terms that get thrown around, like SNF, skilled nursing facilities, long-term care facilities. So people, residents, patients that live there long-term, people that are going so skilled, maybe that they may be going in there for a short period of time because they're not safe to go home. They had a fall, they had a surgery, they're deconditioned, they had some kind of other medical diagnosis. They had to go there short-term and get rehab in order to return home. So what kinds of things, so like in the United States, because we have a lot of people from all over the world listen to this, which is crazy fun. But so in general, in the United States, we have Medicare system run by the government, and it's kind of divided into Medicare Part A and Medicare Part B. And then we have like private insurance and then military, VA insurance, veterans. Sorry, see, I'm trying to get rid of the acronyms. We're so used to throwing around. But from what you guys see, like in working in the skilled nursing facilities that you are at, like what is the difference in Medicare Part A and Medicare Part B? What types of patients are kind of maybe in those categories, and how are they different in a facility?
Yeah, so primarily in the facility that I work at, we work all with Med A and Med B. We rarely have any other insurances. Pretty much some main differences that I see are with Medicare Part A, you have to have like a qualifying event to be a Med A, so that's considered skilled. So you have to, have a fall or have, some kind of event that really sets a decline in your progress for you to be considered Med A. And it's a lot, it's a higher frequency. So you're going to be seen with therapy with me, 5 to 7 days a week. And then you can't have like more than 2 days. You can't go without therapy. So like on the weekends, those are your 2 days for a lot of people. But I also work on the weekends, so it doesn't mess up the Medicare Part A billing. And then you also are only allowed, no more than 100 skilled days with Medicare Part A. So those are some things with that. And then Medicare B, those are a lot more of like our long-term residents. And you don't have to have, a fall, or you don't have to have a specific event. Pretty much it can be, general decline, or, the person, their tremors are increasing with the Parkinson's, and we can pick them up for, self-feeding to see if we can do adaptive equipment with them. And then Medicare Part B actually only pays 80% from insurance. And then you can, so sometimes they're paired with other insurances that can do the other 20, or, sometimes it's the family cost. And then pretty much other than that, it's a lower frequency sometimes, minimum of 3 to 5 days a week you'll see them. So pretty much though, that is all we see.
It is. Yeah. Is your most of the people that you see Medicare Part A?
I would actually say,
or is it
more like, I would say more half and half. We have a lot of like long-term residents. We actually recently, just the past couple weeks, we've seen a couple more Med A's that have been coming in from the hospital and going to be discharged home. So that's kind of rare, but generally Medicare Part B for me.
Well, and the payment systems are going to be changing and the whole thing, but this is how it is right now.
Yeah.
In July of 2018, this is how we're doing it. In Medicare Part A, that's exactly what my experience is as well. Is like in general, I mean, people who come in from Medicare Part A they were most of the time from the hospital.
Okay, yeah.
They've been in the hospital 3 days, and then they get transferred over. And that they're probably that goal is that they probably are going to be going home. They just need that rehab, and they're just not quite safe. But and then a little bit more long-term care. What are some of the things that you really enjoy about working in skilled nursing facilities? Like, I think, because sometimes you listen to all these Facebook groups, you listen to all the chatter, the OT chatter online, and sometimes skilled nursing facilities can get a bad rap, and I totally get it. But there are some amazing facilities. There's some amazing reasons to work in skilled nursing facilities. So what are some of the reasons why you guys like working in skilled nursing or with this population?
I would say overall, I just really enjoy working with that population. I mean, just from when I was a kid, I always loved being around older adults. Like, I would go to my friend's house. She lived with her grandparents, and I would hang out with her grandparents more than her. So I've just always had.
Do you have an old soul?
I've always just had like a passion for like talking and listening to what they have to say. So like, that's one of the things that I love, is being able to listen to all these different people's stories and their, experiences in life and the wisdom that they have that, not a lot of people are really listening to. So, I mean, that's one thing that I really love, but I guess that could just be my weird thing that I love talking to older people. But in the
Are you kidding me? I love it
too. In my experience, at least at my facility, the people that I work with are great, and I love being able to work with the PT and speech, and being able to collaborate in between all the disciplines, because then we can really come up with a plan for somebody. So there's good collaboration in the nursing home.
Yeah. Well, and if you work in a facility that really works, it's so fun, because it allows I personally think you can have so much creativity when you work in a well-oiled, well-working team. And facilities that like really put their residents first, or really have them in the core of why they're doing it. So that stuff is really, really, I think, fun. And, for me personally anyway, I mean, some of my other favorite reasons is that, like, I just always have this passion about, like, I feel like sometimes people and residents in some of these nursing facilities really just I feel like they get lost. They get lost in the shuffle and they don't get to shine and see, their life. I mean, they lived rich lives. And so I love that OT can help promote that as best as you can and where they are. So it can be really amazing, like an amazing experience to connect with those older adults. I love it.
It's like a big family atmosphere too. Like I just love walking in and just saying, good morning, hi. And I know everybody's names, like all the residents. And, you kind of know their routine too. I think that's really, really nice because it, gives them more socialization and it makes them feel that, even though they're not maybe living with their family anymore, this can kind of be like a second family for them.
Yeah. Yeah. Oh, that's a great, that's a good one too. So what are some of the challenges that you see working in skilled nursing? Like if someone's kind of like, oh, I'm kind of looking at working in skilled nursing, what are some challenges that are definitely out there that is just part of the job?
A big challenge that I see is kind of like non-staff follow through, not like on therapy side, but whether it be, nursing or STNAs, if we have, like a splinting program going on. And a lot of times with the shift schedules or understaffing, sometimes it gets overlooked or like incontinence programs. So not all the time what we're recommending gets done. So it's kind of hard in that aspect to see progress sometimes if you're, like contractures and splinting with that. So that's one thing that I get frustrated with sometimes because I feel like I'm always educating people on, this edema sleeve needs to be put on with this splint. And every time they wake up, and then I'll see them like in the middle of the day and I'll be like, oh, where's your splint? It won't be on.
I know. Well, you're so nice about it. I'm not mean about it, but like in my brain, I'm thinking, come on, people, let's do
it's like,
let's do
we're
this.
Working so hard and stretching them, and it's painful for them, especially bad contractures, and then you get some range of motion, and then they don't get to wear their splint for a few days, over the weekend or something, and it's lost. So that frustrates me. And then, there's like general staff burnout, not so much in therapy, but a lot of like nursing and STNAs, again, I see they're just understaffed a lot of the times. And, they're busy, they have a whole list of things they have to do too. But at the same time, you have to make sure the patient's always in the best interest.
Yeah, I completely agree. Those are the things I think are some of the things that are just really hard because everybody has their role, but our ultimate goal is to help the resident and help the patient if you're maybe in the skilled side. And so it's like you're trying to do your job. Nursing's trying to do their job. Everybody's trying to do their job, but there's all those staffing issues and timing and lack of, sometimes, like you say, you feel like you've been educating, and no one's listening and there's no follow through. And then because you're actually not in charge of the nursing assistants, like you can educate them, but like you're not in charge to make sure that they actually do it. That's always been kind of my thing. It's like you have to have the buy-in from the nursing and the director of nursing. You have to have this whole team approach that, to find those facilities, it's out there. And then, and you have some teams that really work well. But those are the things I think that are really, so frustrating. But the other thing that a lot of people get really frustrated about is productivity. So what is, talk about, let's talk about a little bit of productivity.
Well, for me,
go for it.
It's hard because I work, in a skilled facility, but then I also work in a hospital. And so at the hospital, the productivity is kind of where I'm at. It's kind of like a small town hospital. So the productivity is kind of like, not really like a word that we talk about. Yeah. It's like, you best. See whoever comes in and that's that. It's a variable there. So then when I, leave there and I have to go to, my other facility, I'm like, now I have to hustle and, really be on top of things. And it can be a big difference from one to the other.
Yeah. So what's like what are your guys' like productivity levels? Do you have
So
are they strict?
my level is
fluid?
90% as a coda, and then our OTRs are 80%. So
Okay. That's not, I mean, I don't know how it is for a coda, but for an OTR, 80% is pretty good.
yeah, that's definitely, and honestly, like from the coda standpoint, I was PRNing for another facility a couple months ago, and theirs was at 94%, and that was just non-realistic.
Well, I mean,
so 90% is pretty good in that aspect.
I mean, I'm going to throw this out there. 90% is still dumb. It's still ridiculous.
Absolutely.
It's still ridiculous.
Absolutely.
I mean, you have to pee. But,
yeah.
and we all know that, OT assistants obviously have different roles than OTRs. So, they have different paperwork and different things like that. So I get it that, you guys end up having higher productivity, but man almighty, that's still really ridiculous. But so how do you deal with that? Like, what is there do you guys have any tips or anything that you found kind of works or doesn't work? Just really briefly, anything that you find, or is it just kind of like, I do what I can?
Well, one thing that I kind of like to do is, like, when I first started, I had to find a way to really motivate some of the residents or the patients, just because I was finding that I was going in and they kind of knew that, I was new, I'm young, they could kind of try to get out of therapy and try to, manipulate me. So I had to come up with a way to like motivate them, rather than being like, okay, well, you can, watch your show and then I'll be back. I'm going to go see somebody else when I don't have time to, mess around. So trying to, come up with things to really motivate them and encourage them. And, basically what I do is just ask them kind of what their interests are, what their goals are, just to see, how that differs from, if their goal is different from what the OTR said, but then trying to incorporate both of them together, just so it's something that they really do enjoy and want to do, so I can, get them up and moving.
I know.
Yeah. I have, like, I print out my sheet in the morning, and then I'll write everybody's goals down, go through and see them. And then when I'm treating them, some people document. I don't document when I see them. I'm not like typing their note while they're, doing something, but I'll write down on my piece of paper, like, all their assist levels. I will kind of do my billable minutes too, like how many minutes am I going to bill for, self-care, neuro, things like that. So then when I go to sit down and to write my note later, it's all right there, and I can just quickly, go through and make sure everything's accurate. So that's helped me.
I think those little tips help, because I think people get intimidated by the productivity, because, I mean, it's intimidation worthy. I think it's worth being kind of worried about. And some people are like, I don't even want to be or work in skilled nursing because I don't want to have to deal with the productivity. And so, I mean, there are ways around it. The things I say around it, like, we never need to document when you're not, off the clock and that kind of thing. But, little things help. I mean, things that I do is, like, I do a lot of treatments in the rooms. I'm kind of like a pro room treatment kind of gal, not always. And it depends on the patient, obviously, but you have a lot of their things in there, and you don't have to work on transporting them or finding someone to help transport or that kind of thing. But they have their clothes there. They have their sink there. And some of the, all the facilities I work in, like, they have very limited OT-esque things in the therapy gym. They have, like, new step and balls and exercise things, which is great. Like, I mean, there's a time and a place to incorporate some of those, preparatory activities, right? But I mean, like, I like to do some room activities, so that helps a lot too. And, and even things like, I mean, my systems, all the places I work, we have iPads. So I do a lot of dictation. You have to check your dictation because it puts down crazy things, but for me, that helps. I'm much better at faster at talking than typing. So just a couple little things to deal with productivity. So, working in skilled nursing, how do you guys, how does it work, or can you be occupation based working in a skilled nursing facility? Or what are some, I don't know, something to just chat about. What do you guys think about that?
I would say, I don't know if this is kind of what you're looking for, but with like occupation based and trying to help the residents there, we do a lot of like positioning and things like that. And I think that kind of ties into it because you're helping to, promote their health and prevent any, health issues that they could have. So that's like one thing that we really focus on is, making sure that everyone, in their wheelchair, they're positioned correctly. If they need, cushion or they need something that's, documented and taken care of so that, their quality of life is kind of based on it if that's what they're sitting in all day.
Yeah. And I mean, I think it also really just helps them participate in everything that they need to do. So like if that is in a good position, they can eat better when they're sitting up at the table, or that maybe they could play bingo with their friends or something like that. You kind of have to have those basics. But, I guess what I was kind of also thinking about was like, sometimes you're in school and you learn that everything should try to be occupation based, and you should really try to have them participate in those activities that are meaningful to them. And then you get to skilled nursing and a lot of different facilities as well, but skilled nursing. And then people just do exercises all day sometimes. Do you guys ever see that? Or is there a way to incorporate that more occupation? Or do you know what I'm trying to say?
Yeah, I've definitely seen that too, like through my clinicals. And pretty much what I've concluded is if you want it to be occupation based, like you can, like you have to decide to not have your patient do dumbbells for the whole session and do, things that they really don't even understand why they're doing it.
Right.
So for me, like, just asking what they like to do and what they liked to do previously, that opens up a lot. And just knowing that you can adapt pretty much any environment to do something like more fun or more engaging.
Yeah.
So you just have to choose to like spend the extra time. And that's kind of the nice thing too, though. You get to see the patient not every day, but you see them more frequently. So you can kind of, bring things in if you have to, or decide that one day, you're going to go outside. It looks like it's going to be a nice day, on Tuesday. So things to give them to look forward to as well.
Yeah. It's those creative treatments. Have you guys found anything that you feel like has been really successful? Some kind of treatments or some kind of activities that you found that, these residents really like this, or anything like that in working in skilled nursing?
I found that it's easier to motivate some of the female residents, actually. So I had to come up with a way to kind of get the guys going during treatment sessions. So I'm a golfer, and so I always ask, if they like, if they used to golf, if they like golf, anything like that. And usually they say yes. So I'll try to incorporate that into, like a balance activity or something like that. So, that's something they really enjoy, and they don't even realize that it's OT and that they're actually doing what they need to be doing.
Yeah. And that's what kind of makes it fun. I mean, it makes it fun for the residents, and it makes it meaningful, and it makes it fun for, us us doing the treatment sessions. It just makes everything just more fun if you're doing something more purposeful with the patient and meaningful. I don't know. Those are the things I think is fun. I think you're right when you talk about like asking them those things that you want to do, or, filling out like occupational profiles and those kinds of things, interest checklists. And there's all sorts of things you can do to get the information. But I mean, if you have a good understanding of what they like to do, I mean, you can turn any of those things into a treatment session. Like I had a lady that used to work at a salon. And so we would like cracked out the nail polish, but we're working on like dynamic or, like standing tolerance or balance, put it on an aero pad, so you're like doing something purposeful and meaningful to them while you are working on some of those core things that they need to do. So even if your goals are not painting nails, right? That's not going to be our goal, but we may have to work on, balance in order for them to stand and do grooming at sink side. We can still do those activities, just make it more occupation based and meaningful. So, and I always say, if you go into those facilities where like no one's doing anything purposeful or occupation based or fun, you do you. If you want to do it and that's what's meaningful to the patient, do it. Like you do you.
Yeah.
So what kind of assessments do you guys, I know you guys don't necessarily do the evaluation, but like what kind of assessments, evaluations, like objective ones that you guys use in the facilities?
So for me, like I said, I work in the hospital setting as well as the skilled nursing facility. And so FIMS scores, I do that all the time.
Yeah.
In school, like when we first learned how to do it, I was like, oh, I'm never going to remember all of this stuff. Like I'm going to have to carry this cheat sheet around for the rest of my life. To remember all of this stuff and, how to calculate everything. I was like, this is too much. But now it's like part of my everyday life. So that's something that I use in both settings.
Yeah, mostly FIM. And those are the things that I think people use a lot of different assessments or objective, evaluations and those kinds of things. And I know a lot in like skilled nursing, they use a lot of like the modified Barthel, and depending on what kind of diagnosis you have. But, and I know you guys don't do evaluations per se, but I am a huge proponent of cognitive evaluations and staging and helping that. I think it helps with treatment plans, which helps with goals, which help the whole team achieve the goals of our patients. So there's all sorts of things. And using some of those like functional assessments, I think is most important because then you see exactly what they're, a piece of paper doing the mini mental is, I guess, great and all, but that's just a screen to see if you need to do further evaluation. And so looking at some of those components are great, but like, how does that translate into everyday function? Can they actually, balance a checkbook or even use a credit card? I mean, what does that look like? So it's just using some of those assessments and evaluation tools to kind of help guide treatment and make it meaningful to the patient. So what kinds of goals do you guys typically see? I know you guys don't establish the goals, but you sure work on them a lot.
Yeah. Primarily, a lot of goals that I see are like upper body strengthening, biceps, triceps, just for transfers, for more functional transfers. Dynamic standing balance, which would carry over into, ADLs, and then like toileting too. And then self-feeding. I've been seeing a lot recently, which I love self-feeding. It's one of my favorite things to try to help somebody figure out what can I do? How can I adapt this? Do they need, a different utensil? It is amazing, all of the utensils that are out there too. I'm still amazed at everything.
Do you guys have like a good collection of things to try?
We do. We're very lucky.
Oh, you do? That's good.
We're very lucky. And we have like a lot of things too. Like we could, make our own built up utensils or extra grip things, and we have a lot of different cups too, which is very nice to at least trial, and then we can order one for them.
Yeah, and I think that's always the thing. It's like you get sometimes in these facilities and they like don't even have I need the basics, and try things out.
Exactly.
Because like you don't even know exactly what's going to work until you actually try it with the resident. Because also sometimes something you're like, I know this is going to work. Like this is totally going to work, and then the resident's like, yeah, I don't like it, and you're like,
I know
it works.
I know.
But that's why you need to, trial and error.
Yeah,
right?
I had this one lady. She was so sweet. She had tremors with her hands, and also her mouth had a small tremor to it. And we did like a weighted cup that had, a lid. And she tried it for the first time. She was like, I've never even seen this before. And I was like, we're just going to try it for today, for lunch, see if you like it or not. And she was so excited. She couldn't stop hugging me. She was like, I get one of these. I was like, yeah. And she's like, I don't have to spill on myself anymore. Like, it was awesome. It was one of those days where it's like, you feel like, you're appreciated and like, this is why you went to school. But it was so cool. And I just think like, along with self-feeding too, it's like instant gratification. If something works, that's it.
Mm-hmm.
So you've helped them, and like they'll be able to use it in the upcoming months, just to keep feeding themselves independently. Something so simple that we would take for granted that we're able to give back to them.
I know. I love those stories. That's why you do it. But I mean, the other thing is like, I always kind of put myself in their shoes. And I don't know if that's part of it is because I had such a relationship with my own grandfather that I just feel like, what would I want for him? Or what would I want for myself? Like anybody can experience a lot of these, diagnoses, or you can have a traumatic event, or all these things happen. Life happens. And it's like, I guess part of it is I'm always like, what would I want somebody to be for me? Like, how would I want to be cared for? what are some of the things that would be important to me? And so I think that's part of it for me, is probably just very selfishly. I love that I can help them too, right? I think it's like a win-win for everyone. But I don't know. So like when you were applying for a job in a skilled nursing facility, what types of things did you want to know before you started your job? Or now that you already have the job, what are some things that you were like, I wish I would have known before? Do you know what I'm saying? Like if you're kind of like new to the world, like, okay, I'm going to go into a skilled nursing facility, what kinds of things would be good questions to ask?
I would definitely want to know the productivity.
Yeah. Oh yeah.
That's for sure. And then, like right now I'm just PRN because I'm still, I'm going back to school. So I guess for me, it's just kind of like caseload and what the schedule is going to look like, because it definitely varies. So, I want to make sure that I'm able to, work and get in there and do something. So just knowing, what the schedule is going to look like and being prepared for that. So I know, if I need to apply somewhere else or something like, just on the side. So knowing the schedule.
Mm-hmm.
Yeah, for me, I would say also like mentoring. Since like, I was a new grad, it was nice to be able to have somebody that I could go to throughout the day to say, I just want to double check that this is right, or, where do I go for this? Even just, around the facility, because I get lost in facilities half the time. That, and then kind of like Allie said with the caseload, the company that I work for now, they have about 5 other facilities in the area. So if the caseload gets low, you'll have to go there. If you want, your full hours, you'll have to go to a different facility. So I would definitely ask if, if you are guaranteed 40 hours, or if you're going to have to, go to other facilities to get that, if the caseload gets low, things like that.
Okay. Yeah, those are some good things to know, because it's like those things, like sometimes like when you're changing settings, it's like you actually don't know what you don't even know. Like you're like, I don't even know what to ask them because I don't even know. But I think things that I think about is like, you can ask, like, let's say example, they're like, oh, productivity is 90%. And you're like, okay, I've never worked in skilled nursing facility before. I've never, this is a whole new thing to me. You can ask saying like, hey, can I start out like a lower productivity and work my way up until I get comfortable? Or, like you said, you have a mentor, you have somebody to ask questions to. Those are important things to know depending on how comfortable you feel. Did you guys have a full-time OTR at your facility,
yes,
Holly?
we do. She's awesome. She is at our facility, and so we have like 2 facilities that the OT and the PT both jump between, but they're there every single day. They split their days between the 2.
Okay.
So,
and that's something something important to know, especially if you're an OT assistant, like how often is the OTR there? Because I mean, I've worked at facilities where it's in general, like the OT assistant's there all the time. Granted, she had like 30 years experience and she knows exactly what she's doing. But you go as an OTR, I go in and do some evals and then maybe see a couple patients that she can't see. And then that's it. And then like supervisory things. And like, if you're new, like that would be really stressful because one, you're not even in charge of the plan of care and they're not even there. Like,
yeah, it was really helpful for me because in the mornings, you know, she would say, oh, you know, who's on your schedule? And we'd kind of go through and she would, you know, talk me through, you know, this person, what she would recommend to do. And then it was nice too because I could bounce ideas off of her. So just being so new, you know, what was appropriate, it was awesome. You know, I was very, very lucky.
Yeah. Yeah, it's just crazy how like you don't even think about that when you're applying for a job necessarily. And then you're like, ooh, that's actually super important to know.
Yeah, and then it's like, okay, what do I do?
Yeah. So I'd say
I'm here by myself.
Yeah, and, you know, and that's okay if you kind of feel like you've been doing it for years. But if you're kind of new, that's kind of it's intimidating. It can be super intimidating. But okay, so that is one thing. You know, other things I always kind of want to know. Obviously, like you said, productivity. You know, supervisory roles and who's there and that kind of thing. But even things, you know, obviously the things like what is the caseload? Am I going to be working mainly with skilled, you know, patients on Medicare Part A, which is like skilled, which means they come from the hospital. It's more of a rehab, as in they're trying to transition home. Or are you going to be seeing more patients in long-term care? That may be important to you. And then is there like a dementia unit or is there, you know what I mean? Like what types of patients do you typically see? I think it's really kind of, some people just want a job. I totally get that because I've been there too. But sometimes you want to kind of like make sure you know what you're kind of, you know, getting into when you're doing that. And then like things like what happens, like who is the director of rehab and like what is their role? Do they see patients? How do they feel about if you don't feel like a patient can be seen for 90 minutes, 5 days a week, how is that handled? How do we go about that thing? So like, I think that part of it is communication and just having a good understanding. But yeah, I mean, those examples are exactly what you'd ask. So, you know, let's say someone's thinking about working in skilled nursing. What kind of qualities do you think an OT assistant or an OTR would need in order to work in a skilled nursing facility?
I would say that definitely you have to have a passion for wanting to work with that population. I did one of my clinical rotations in pediatrics because going into school, I was like, you know, I already know I don't want to work with kids. Not that I don't like kids, but it just wasn't really my thing. Yeah. But I wanted to try it to make sure because you never really know unless you do it. Yeah. So I did that, you know, it wasn't really my cup of tea. Yeah. So like, I don't know. I just felt like, you know, when I'm really passionate about something, I'm able to give it, you know, 110% and really help them. And if you're not passionate about it, you're not going to get them motivated. So I would say that, you know, you really have to like the population that you're going to be working with, or else it's just not going to work, and the patient's going to know that. Yeah.
Oh yeah, they know it. And they probably gossip about it.
Yeah, and they'll tell you.
Yeah, they'll tell you, or, you know, they'll tell all their friends.
Yeah, another thing, I think like you have to really just go with the flow almost, just because there's so many things. Like you can't have your day planned out, that it will never go as planned. So you have to really be able to like adapt to what you're going to do. Is this person, you know, not going to do this today, so we have to do this, you know, be able to adapt and be able to have patience. Because, you know, these people, they're so sweet. And sometimes they just, you know, want to talk all about their day. And you're like, oh my gosh, this is so nice. Thank you for sharing. But it's like, oh, I got to go for productivity. But you're like, oh, like, I love it. So definitely having patience and just like being able to adapt to anything. Like people, they're great. They just do the craziest things sometimes, and you're like, oh, didn't expect that.
And they say the funniest things.
Yes.
I know. I do love that. You know, I had a resident that always called me Mango. Like, I don't know. He'd be like literally, yo, Mango Mandy, over here. And I'd be like, and so I started like, you know, I don't know, calling him pineapple or something, or like, you know what I mean? And I'm like, where did you get it? He goes, I don't know. I just feel like you are very Mango-esque. And I was like, oh, thanks. But I mean, he didn't have any like cognitive limitations, or he was just like a silly guy. So it was always like Mango Mandy. And then after, and then actually he ended up passing away, but I was like Mango Mandy with all like this whole wing of the residents, this one wing for like ever. See, those are the kind of fun things. Cause like you said, you really get to know them versus just like in an outpatient setting and that kind of thing. So yeah, I agree. Good, some good advice. So, you know, just like in addition to working with older adults and working in skilled nursing facilities, and you guys really both enjoying working with older adults, you guys decided to develop your own company. Can you talk about that a little bit?
Yeah. So after we did our clinicals in different nursing homes, we just kind of talked about how, you know, you see a disconnect between families. You know, a lot of kids and grandkids move out of town for jobs and different things like that these days. So there's not really that connection there with their older family members. And then just overall kind of like loneliness and boredom we would see. So we would just talk about that, and we decided to come up with what we now call Purpose, the therapy box, which is something that families can subscribe to on a website that we have, and it will be sent to, you know, it could be sent to, you know, nursing homes, assisted living, their own home if they're still living at home. And it just has products in it that help keep them independent, keep them active. We want to send, you know, things to stimulate the mind and really keep them going. And then families are able to, you know, put in pictures and messages to kind of keep that connection there.
Okay. And it's called Purpose Therapy Box?
Yeah.
PurposeTherapyBox.com.
Yeah. PurposeTherapyBox.com. Yes.
And so it's kind of like a little fun subscription care package to a loved one. Is that's kind of my take on it.
That's a short version.
Yeah, I'm sure it's way more complicated than that. I mean, from your end. But so like, can you give me example of like a box and like what's in it?
Yeah. So right now we're working on a cognition box. So in there we have this book. It's a 300-page book with enlarged font, and it has you know, crossword puzzles, riddles, all these different things to kind of keep them thinking, keep their mind sharp, working on memory and executive functioning. We have in there large print playing cards. We actually went to different nursing homes in our area and kind of almost surveyed residents and kind of seeing what they would like. So these are some of the things that they said, you know, they would use and that they like to use. So that's kind of where we got a lot of our ideas.
That's fun. That's such a fun way, like for family members, like you said, like that don't live close, to kind of give a little surprise box of fun. Surprise box of fun. Maybe that's what you call it. You call them PurposeTherapyBox.com.
And it's kind of hard.
And so you guys are
sorry. I was just gonna say it's kind of hard, you know, to come up with a nice gift for an older person that they actually are going to enjoy and be able to use. You know, you send flowers or chocolates, which, you know, are nice, but they're not going to last very long. We want to send things that they're going to be able to use over time and that are really going to help them.
And it's, I mean, honestly, like a lot of the residents, they just like really enjoy getting mail. I mean, like even the letter writing era is not completely dead, but you know what I mean? Like they just really enjoy feeling thought of, and just getting something is like so joyous. And so that's such a neat idea.
Thank you.
Gosh, and you guys are really going for it. So, okay, so purposetherapybox.com. And then I also saw on your website that you give a 10% discount to the box. For the boxes if you sign up for the newsletter.
Quarterly boxes, if you sign up for our newsletter, you could get 10% off. And then we also have other one-time purchases for boxes. We have a birthday box and just like a general thinking of you box, if it's, coming up on, a special occasion or something, you just want to send them a quick box with some nice keepsakes, and you can put a little note in there saying that you're thinking of them, see you in a month or, something like that.
Yeah. That's such a neat idea. That's super creative, guys. So I'll put that in the show notes. So purposetherapybox.com with a 10% discount for the quarterly box. Is that correct? Making sure I have it out there, right? For the quarterly box, if you sign up for their email. But check it out. It's fun. Also, I mean, not only is it fun for the residents, but I think it's fun to connect with other OT entrepreneurs and support each other and, talk about the products that we develop and share with not only obviously our residents, but like the caregivers and family members that we
would
help
love
educate.
Any ideas. If anybody has anything that they think their residents would like to see in a box, we're always up for suggestions.
Oh my gosh, that's a great idea. Don't get me started. I might have some ideas to contribute.
Love to
hear. Well, thanks you guys for talking with me today. Thanks everyone for listening, and hope you got maybe an overview of what it's kind of like to work in a skilled nursing facility. And until next time.
Do you feel like you're navigating the OT world without a map? Not feeling confident or competent in your day-to-day treatments and struggling to apply your knowledge clinically? Then be sure to check out the Seniors Flourish Learning Lab membership. It has all the treatment ideas, patient handouts, clinical resources, community support, and mentorship you need to succeed. Join today at seniorsflourish.com/learninglab.